Hi, I'm Dr. Lindsey Tavakolian. I'm a plastic surgeon, and I want to talk to you about screening recommendations for breast implants. If you have breast implants or if you're interested in getting breast implants, then you should know what the current FDA recommendations are for screening for a silent breast implant rupture. The FDA currently recommends that 5 to 6 years after your silicone breast implants are placed, that you have your first screening. This can be done with an ultrasound or an MRI. More on that in a minute. The second screening or subsequent screening should happen 2 to 3 years after your first and should continue for the life of those implants until you remove them or replace them. And then that screening starts over again at 5 to 6 years after you have your new implants placed. So my recommendation and my preference for my patients is to do the screening with an ultrasound, and for a few specific reasons. One, it's more affordable than an MRI. It's on the order of a few $100s, and it is more accessible than an MRI. It can be done in my office. I'm personally certified in screening with an ultrasound to detect silent breast implant ruptures. And I do this in my office. It takes about 15 minutes. You can do it on your lunch break or before or after carpool. It's in a comfortable setting, and I give you immediate feedback while I'm doing the exam as to what I'm seeing on ultrasound exam. Now, there's always limitations to ultrasounds. There are some people that it doesn't quite work for. Body habitus sometimes interferes with the ability to get to the right depth that you want to get to get to see the implant. And then sometimes there are clinical questions that I have that aren't quite explained by what I'm seeing on ultrasound. And I need to see more, understand more of what's happening with surrounding structures, or really have a radiologist's eyes on the issue. In those rare circumstances, I will send somebody for an MRI for follow-up, but that's pretty rare. Most of the time, just general screening can be done with an ultrasound in my office. Very affordable, very accessible. And then the other reason why I love the ultrasound is because it's actually very accurate. So in the past, when plastic surgeons discuss why you would do MRI over ultrasound, a lot of times we would talk about how the MRI was a better test, that it was more sensitive and specific for detecting a breast implant rupture. Well, recent research has shown that the sensitivity and specificity of high-res ultrasound performed in a plastic surgeon's office is actually really high, and it's a really good test, performing about to the level of an MRI. The sensitivity was found to be 90%, which is high, and the specificity 100%, highest it can be. So a test like the ultrasound that's performed in a comfortable setting, not in a tube, isn't anxiety provoking, can be done on your lunch break, takes 15 minutes, and also with a plastic surgeon that you can grow a relationship with and that can take care of your implants over the life of those implants. I just think it's the best imaging modality. Now, of course, if there's a clinical question that can't be answered, then an MRI may be in order. It is never too late to start screening. Oftentimes I meet women who have had implants for many years and have never had a screening done before. I encourage you to start now. The reason why the screening is necessary to look for what we call silent implant ruptures is because, contrast this with a saline implant. When a saline implant ruptures, it deflates. The body absorbs the saline and it's visible. It's obvious in most people. With a silicone breast implant, they still retain most of their shape, and certainly the volume of that implant is still within that breast. And so oftentimes the rupture happens a long time before it's detected, before anybody notices a change, or you may never have symptoms of a change. And so in order to detect those ruptures, which are an indication to have your implant replaced or removed, it's important to do screening because they're not necessarily appreciable on physical exam. So screening is very important if you have silicone implants. It's never too late to start. A screening with an ultrasound is affordable, it's accessible, and it's accurate. So I encourage you to make an appointment with a plastic surgeon. If you're in my area, I would love to see you, whether or not I placed your implants, and help get you on the right track. If you have any questions, please leave them in my comments and I will do my best to answer them.